Hello, I'm Cathy Hasty, and I'm in Charlotte, North Carolina, which is in the southeastern United States. And I use clean language in healthcare. I have several roles, and I use it a great deal. I oversee faith community nurses. I oversee a community chaplain, and I am on the faculty to teach interfaith chaplains. That's probably the place that I'm using clean language the most right now. I want to say that at first I was not that taken with clean language. I think that's important to say because once you get involved in the community, it's a very enthusiastic community. And I can't really say why I didn't take to it immediately. I'm sure it was all my own fault. But since I've gotten more involved, I've been so impressed with the ability of this deceptively, apparently simple set of questions that allows people to decrease their assumptions and their bias and to truly meet people where they are out of a sense of curiosity and less contempt, less criticism, less judgment. And that's especially helpful for hospital chaplains. So I teach people to become interfaith hospital chaplains, which requires a couple of years of residency. Beyond the residency to become able to sit for the exam that is a board-certified chaplain, it takes another, sometimes 3 to 7 years to become a person who can train interfaith hospital chaplains through the Association for Clinical Pastoral Education. The way I've used it is both in helping the group to talk to each other. The residency they're in includes a lot of learning in groups, and they do present their work through verbatims. They write word for word what they have said. Now, for people who don't know much about what a hospital chaplain would do, they are at the intersection of a lot of crisis and death and trauma. They work with patients and families, and they work with team members or staff members in the hospital. Sometimes they can have as many as 10 or 12 traumas and gunshot wounds that they tend to in one night of on-call. So they serve both during the day, and we have 24 hours coverage. And so just for an example, you go to a bedside and say there's a son there who's found out that his father's just died. And one of the chaplains changed the way they would ask questions when the person said something like, he was such a special dad. And using clean language, the chaplain might say, and he was a special dad. And what kind of special dad was he? And that allows the person to go wherever they need to go. Another question that is very important is the question, what would you like to have happen? And that can be a good question for someone a wife who's just found out that her husband has some diagnosis that feels so overwhelming that after listening and attending in many other ways, they might ask, well, right now, what would you like to have happen? And that gave this wife a chance to say, I think I need to go home and tell my kids and come back later. I just don't think I have much capacity. I do encourage the chaplains to use just a few questions, not many. The what kind of question and is there anything else about question are great questions. Sometimes the where question, the whereabouts question. Another way I've found to be so helpful is to help residents to listen for metaphors and to develop their own metaphors. They have to do very elaborate final evaluations every 3 months as part of their training. And so one of the additions to our final evaluation has been when you are at your best as a spiritual care provider, that's like what? And we've attuned them to think in terms of metaphor and to notice metaphors and to notice how robust a conversation can be if you track the many, many metaphors that are there. So I've really appreciated the community. I appreciate Judy Reese a great deal, and I'm so happy that we have a community supporting all of us who want to use clean language in healthcare. Thank you. Bye.